Ladies and gentlemen, you are welcome to this brief outline on ECT, also called electroconvulsive therapy. I'm Dr. Tettey Doe, a registered practitioner in psychiatry, a doctor in the United Kingdom. Briefly, the outline will be as follows: physical treatments, risk of ECT, before ECT, during ECT, what happens and afterwards, and the indication for electroconvulsive therapy. It is a physical treatment for conditions including severe depression and is performed under general anesthesia, and medication to relax the muscles is given. It works by causing a seizure, which is small and modified, and electricity that passes through the brain and is controlled, which is only for a few seconds. The ECT works faster when antidepressants fail. The risk is the same as in general anesthesia for minor procedures, and less than 1 in 50,000 treatments are there any risk. They minimize this risk by proper physical examination and blood tests, and ECG, electrocardiogram of the heart, before ECT is done. There are side effects, mild side effects, which are short-lasting, and these include muscle pain, nausea, headache, confused for a few hours, and memory loss, which is also transient. To minimize side effects, one gives the lowest dose possible of ECT, and if memory loss is a problem, both electrodes are placed on same side of the head. Now, before ECT, the anesthetist sees the patient, and the patient fasts overnight and is taken to the ECT suite by a nurse, and the anesthetist will be waiting there. And during the ECT, the patient lies on the couch, oxygen is given, and there's monitoring and recording of blood pressure, heart rate, and the anesthetist is in charge of a drip and also gives a muscle relaxant and an anesthetic, which is general anesthetic. The patient is asleep, and the ECT electrodes are applied, and the dose of the current is given, and the seizure is less than 1 minute. That is in the form of a twitch. After ECT, the patient may be drowsy, and nursing staff stay with the patient till he or she is ready for the ward. The sessions, number of sessions, usually 6 to 8 sessions, and consent is needed. So one needs to discuss with the patient, the family, and friends, as the case may be. Sometimes mental health acts has been applied to a patient, and in this case, consent is not possible, or the patient may be very unwell. So a second opinion doctor may be called. And according to the NICE guideline, National Institute of Clinical Excellence, ECT is recommended for severe and life-threatening depression, catatonia, prolonged or severe mania, and one needs to assess the patient after each session and stop when response is achieved. So, ladies and gentlemen, that's the end of the presentation. And I wish you all the best in your career and in your studies. Bye.